and then we had Obamacare, healthcare reform, and different things in the past. But I have 20 plus of experience doing health insurance in New York. So today, on behalf of Empowerment of Asian American, the board of directors, Ellen, next screen, please. Yeah, Lenny Chan, Ellen Fong, Priscilla Falk, myself, Winnie Pan, CCM, Annie Wu, and Fran Wu, to welcome everyone to join our second workshop series today. So our presentation today is about health insurance option during the pandemic. And we know that during pandemic, people changed their income, people lost their job, people got cut by their hours. So we understand that also health insurance is very important at this time. Many people may already lost their coverage and they're looking for coverage and they don't know what to do. So hopefully this section will able to assist you. And again, feel free to ask any question if you. And in the past 6 months, and looking for insurance, 4 questions. That's why I want to bring up this 4 questions and give people, all of you, an answer. Okay, so the first question here is, I recently lost my job and my health insurance. I lost my job and lost my health insurance. What should I do? So the answer to all of you is, if you recently had a change in income, so you may be both husband and wife, you're both working. So let's say one of you lost your job, or even both of you lost your job, and also lost your insurance. So you may qualify for health insurance program that may be better fit for you. And you may be eligible also for other lower costs or even free health insurance that keep you covered. And of course, we know that many employer, even though you're no longer employed, you do, your employer may offer you a COBRA. COBRA is very expensive. We know that because employer no longer contribute for your health insurance coverage. So in this scenario, you are the one who pay for the entire insurance cost. And this is very expensive. And since your income is changed or you no longer have income, this is not affordable. So of course, there is options right there for you. So my next question here, Alan, next screen, please. So my income changed during the crisis and I may not able to afford the health insurance I have now. So what should I do? And of course, like I mentioned earlier, if you cannot afford your current premiums, so even though you're still working, okay, but you have lower income, or just because you work less hours, or maybe your union contribute less money, you have to contribute more just because the pandemic. So you may be able to switch to a lower cost state-sponsored program or even free health insurance. Of course, by contact New York of Health Marketplace at this number, or your local facilitated enrollment representative. Next slide, please, Ellen. Ellen, are you there? Okay, so the next question I have here is, I lost my job and have no income, but I still want to get health insurance. What are my options? So with this question, I will bring the option here to all of you. You may be eligible to apply for qualified health plans, which is we call Obamacare, essential plans, special for New Yorker, Medicaid for low-income individual families, or Child Health Plus for children under the age of 19. So for example, if you have a qualified life event, what is qualifying life event? For example, you lost your job or you change of your income. This is a qualified life event. Or family size change, you get married or you got divorced, or you have a new baby. So family size change also we call as a qualifying life event. So you may be enrolled at any time during the year, during this time for new health insurance programs. So next slide. So let's talk about the insurance option now. I mentioned at the previous slide, we have 4 different options: qualified health plans, essential plan, Medicaid, or Child Health Plus. So for qualified health plans, so it's an insurance plan certified by Health Insurance Marketplace and provides essential health benefit, including doctor office visit, hospital, prescription, mental health, lab, and radiology services, and pediatric vision and dental. So of course, with the qualified health plans, you have cost sharing, for example, like deductibles, co-payments, and out-of-pocket expenses, okay? And also meet other requirements under the Affordable Care Act. So qualified health plans is one of your options if you have you work less hours, but you're still not high income family, okay? Let's go by federal poverty level, because all insurance in the country, they go by federal poverty level, FPL. So if your income is over 200% of FPL level, okay, you will receive assistance by purchasing qualified health plans, assistance on your premiums, and assistance of your out-of-pocket expenses. Okay, next slide, please.
Shorter now. So.
There's a lot of stuff we looked on the 11. Kaden looks like you're a teenager.
Okay, essential plans. Essential plan is a health plan for New Yorkers, and it costs much less compared to the qualified health plans, or even though your employer-based coverage. With the essential plans, there in the entire United States, only 2 states offer essential plan. New York is one of them, and another state is Minnesota. So we are lucky, we live in New York, we got this plan to offer in New York State. So with the essential plans, you get all the health care benefit, including outpatient services, hospital, inpatient, prescription, also radiology services, lab, and etc. So with this plan, your income level, we go by FPL level, has to be between 138% to 200% FPL. If your age adult between 19 to 64, if you live in New York State and you're not qualified for Medicaid, child health insurance program, or any other affordable employer-sponsored coverage, you are eligible for the essential plan. And the premium and the monthly premium is $0 or $20 per month. And this is very affordable. Okay, next slide, Ellen. Okay, Medicaid. And many of us already know what is Medicaid. Medicaid is federally aided state administrative program for eligible individuals and families with low income and resources. And you could be a newborn baby, you may be eligible for Medicaid. You could be a senior up to 100, 120 years old. You may be eligible for Medicaid as long as you meet the eligibility requirements. Number one is income. If you're under the age of 65, or Medicaid is looking at is your income, your FPL level has to be under 138%. You must be New York State residents, and you must have a legal immigration status. If you're under 65, okay, Medicaid do not look at your resources. So that means if you have money in the bank, if you have a savings checking, if you have a 401k, if you have any stocks, or even though you have 2 houses, you have second property other than your home, If you're under 65 in New York State, they don't go by any resources. So that means as long as you meet the income under 138% FPL, you live in New York, and you're a legal immigrant here. You have certain immigration status. For example, you're a green card holder, permanent residence, you're a US citizen. As long as you meet these requirements, you are eligible for Medicaid. The next slide, please, Alan. Child Health Plus. Child Health Plus is the New York State sponsored program for children under 19 years old of age with full range of healthcare services for free or low monthly costs. Okay, what is the eligibility requirements? Number one, children under the age of 19, live in New York State, household size and income, not eligible for Medicaid, and all children under 19 may be eligible regardless of the immigration status. So that means if your child doesn't have any immigration status, or they're coming in, they're here, like, for example, they're student, or they don't have any status, they're still eligible for Child Health Plus programs. So these are the insurance options here. That's the 4 different plans here. For those, you have your income change. For those, you have lost your job, or your employer stopped offering health insurance. These 4 programs are your options, okay? We understand that during this pandemic, it's difficult, we are working less hours, people lost your job, but these are the health insurance options for you. Next slide, please, Alan. Okay, another question people ask every day about public charges. So the question here is, does enrolling into this program, the health insurance program that I mentioned, make me a public charge? The answer is, the health insurance coverage is not a factor in the new public charge rules, because only Medicaid is included, because Medicaid is funded by federal governments. And even though you get Medicaid, and there is several exempt group of people who are excluded under the rule, the public charge rule. For example, pregnant women, children under the age of 21, also asylees, refugees, or some visa holder who are victim of trafficking and other crimes, among others. And this group of people are exempt from public charges. So a pregnant woman having Medicaid, and they're afraid of having, I cannot become citizen, or I'm applying for green cards. I'm afraid that if I get Medicaid, I'm having an issue. I cannot become citizen. Okay, if you're a pregnant woman or under 21, or you're asylee, refugee, or certain visa holders who are victim of the traffickings, you do not have to worry about public charges rule. You are exempt from this group. Next slide, please. Okay, so the following programs are not included in the public charges rules. We talk about Medicaid, right? We talk about 4 different programs. Medicaid, on public charges, this group of people are exempt. So the next 3 programs, essential plan at any level, even though you pay $0, you are not included in public charge. Child Health Plus, even though the child has visa or they have no document, they're undocumented, they have Child Health Plus, even though they apply for green card later on or they become citizen, public charges are not included for Child Health Plus. Qualified health plans, Obamacare, the middle levels, any level, even though the premium is free or you're eligible for tax credit, public charges are not included. So the conclusion here is many people ask about public charges in the past few months. You don't have to worry about that. If you're eligible for essential plan, you apply for Child Health Plus, you purchase qualified health plans, even though you're on Medicaid, if you're one of the exempt group, you don't have to worry about public charges. Next slide, please. Okay, any questions? Any questions? You can type at the chat if you. Okay, I have Melissa Lamb. What if we live in New Jersey? Okay, I'm not expert for New Jersey. I have been doing New York State only, but I can give you an idea. For New Jersey, qualified health plan is available. And if you lost your job, if you change your income, qualified health plans will be available for you. You live in New Jersey. Children health insurance program will be available for your children. New Jersey will be a little different, but you can go to healthcare.gov for if you're looking at insurance in New Jersey. It's not a lot of difference, especially qualified health plans, because this is like Obamacare is nationwide. But different state, you have different insurance carrier. So you need to shop and the premium are different, okay? And definitely you can purchase if your income has changed or if you lost your job, you can. So go to healthcare.gov. Medicaid also available in New Jersey. Child Health Plus available in New Jersey, and qualified health plan is available in New Jersey, except essential plans. So the next question from Melissa Lamb is retirement counts. If you receive Social Security income, that income counts. Yeah, we understand that you may be your husband and wife. The husband is retired receiving Social Security income. Yes, that's income counts as family income. And the wife may be lost her job or work less hours. Yes, the wife income will be counted too. So both husband and wife income will be counted together as family income. Any other questions? Okay, I have a question from Alan. Is there a deadline to sign up? Just because of the pandemic, there's no deadline always for Medicaid, Child Health Plus, and essential plans. For those who are eligible for these three programs, you can sign up anytime during the year. And even qualified health plan, just because during the pandemic, qualified health plan open enrollment has been extended to October 15. You can still sign up if your income changed or you lost your job. Okay, so I have another question here from Galaxy S9. Can you explain more on essential plan and how to apply? Yes. Essential plan is for adults between 19 to 64 who live in New York State, any counties, if you live in New York City is fine, who live in New York State with income between 138% to 200% federal poverty level. I can give you an idea. For example, family of 4, if your income, like husband and wife and 2 kids, family of 4, if income is about $51,000 a year or less, you are eligible for the essential plans. Okay, and how to apply? You can contact New York State of Health Marketplace by calling 1-855-355-5777, or you can leave your contact information at the end of the meeting, and I can have one of my team member reach out to you and to assist you and give you more detail. Or even my team member can email you some essential plan information. Okay, the next question I have here from Frank. Are Medicare rules different in New York from New Jersey? Medicare rules are the same. Medicare is federal, so Medicare are the same for disregard you in New York or New Jersey. So any other questions? And again, health insurance is very important for all of us, especially we are immigrant. We came to this country, but the healthcare cost here is so high, so expensive. You spend a day in the hospital that costs you like over $10,000. So health insurance is very important for all of us. You're buying a car, you have to buy a car insurance. You are buying a home, you have to buy homeowner insurance. And what is more important than your own health? So health insurance is very important for all of us, since there's option here for all of you. If you lost your job or has changed your income, yes, this is the insurance option. So thank you very much. And Alan, you can take over.
Thank you, Freddy. Thank you so much for all of your participation. And if there's anything that you want to ask and might not be, there's some questions that is not on your head right now. So feel free to subscribe our Facebook page is EAA NYC. We are going to also frequently post our future events and also community resource to share to all of our community participants. And in 3 weeks, we are going to have another workshops relate to our senior population. And so thank you so much for coming. And again, please subscribe our Facebook page, EAA NYC, and we will share our future events more frequently. Thank you so much.
Thank you very much, everyone. Enjoy your week. Enjoy your evening.
Thank you. Have a good night.
Good night.
Bye-bye.
Thank you.